Well, there's a very famous line by a Conservative politician where he is on record as having said, we're not going to tell them that we're privatising the healthcare system because there would be a revolution in the streets.
Hello and welcome to A Doctor's View, a podcast looking at everyday health topics and life through a doctor's eyes. Please note that all opinions are my own and should not replace the advice given to you by your own doctor. I'm Dr. Bolivios. Let's begin. Hello everyone, welcome to Doctor's View. Today we're going to be talking about the NHS versus private healthcare. The NHS is the National Health Service in the United Kingdom, and this is what allows us to have universal and free healthcare throughout the UK. In recent times, a lot of comparisons have been made between the NHS and private healthcare, with arguments for and against each one. Joining me today is a doctor who can help share much wisdom on this topic, and that doctor is Dr Aislinn Macklin-Doherty, who is an oncology trainee and on the British Medical Association, the BMA committee during the junior doctors' strikes in recent times, and a national officer for the National Health Service campaign group called Health Campaigns Together. Aislinn, welcome to the show, and thank you very much for joining us today.
Thank you. I think that's a bit of an overstatement, but I will try my best. I've certainly got opinions about it, but yes.
That's what we need. So firstly, we're in the UK. We have, I think, is a fantastic system in that we're entitled to essentially free healthcare from birth all the way up to old age. Yes, we do pay in forms of national insurance, but on the whole, we don't have anything to really worry about relative to other countries. I think that's a fair thing to say.
Yeah, I mean, I think that's a good summary. I think, the NHS, as we know, is one of a number of different types of healthcare models, and it provides universal healthcare coverage for the entire population, regardless of income. And there are lots of different other types of models to do this, but ours is funded through taxation predominantly, and yes, partly by national insurance. But one of the main advantages is the fact that it is totally irrespective of your status in society, your income, your employment.
Doesn't discriminate, basically, does it?
Exactly, on age, race, ethnicity, gender, background. And I think is one of the kind of most progressive forms of delivering healthcare, if you believe healthcare is a human right, which I believe. And as you rightly say, I mean, it's often kind of lauded as this kind of highly moralistic way of providing healthcare, but actually it has repeatedly been shown to be one of the most effective, cost-effective and most efficient ways in delivering healthcare across the country, across the world. But actually, interestingly, in the UK now, we're spending less as a percentage of our kind of national wealth on healthcare. So I think we're in an age where healthcare is an increasingly important political topic in terms of how we deliver it, because it's about getting the right balance between political decisions, economic decisions, moral decisions that society needs to make about where our priorities are. And I think the NHS is in trouble because of that.
I do agree. It's an absolutely fantastic system. And obviously we both work for the NHS, and we
bit biased.
So it is a slightly biased viewpoint. But I do know lots of people that work for the NHS that think it's not, for various reasons. And it usually comes down to the way that they're treated as a employee rather than the way it treats patients. Treats patients, exactly. Yeah. But looking at the way the NHS is structured and the rest, yes, it's absolutely fantastic. I will concede that there are drawbacks to it, and it does lend itself to what I would believe is a little bit of abuse to the system. For example, I've had patients and colleagues have had patients waiting in A&E for 4 hours for a paper cut, as it were. Yeah. And without realizing that this costs the GP, it costs the hospital, it costs so many different there's so many different costs about just turning up to A&E.
Yeah.
It's about 150, 160 pounds I think a go every time you go to A&E, regardless of whether you've got anything wrong with you or not. And I think there's this almost sense of self-entitlement which goes with it. I think patients do feel that they need that they have a right to it, and yes, they do have a right to healthcare, but the level of expectation has, I think, changed over the last few years at least.
Yeah.
So
no, I think that this is such an interesting question. I've thought a lot about.
Yeah.
This topic comes up repeatedly. Interestingly, commonly amongst colleagues, my doctor colleagues will often have this discussion about this kind of privilege attitude of patients.
Yeah.
But I think to kind of really get to the kind of nub of the question, there's lots of different factors to kind of break down when you're talking about kind of the right to healthcare. Firstly, I think there is a political narrative driving this idea that the system is being abused, that I believe personally is being overemphasised in the current political climate. Because if you look back through history, in 1948, when the NHS was first founded, this was the single biggest fear, that it would be set up and it would be absolutely overrun with these undeserving poor, and people would flood in from other countries. This was a really enormous fear that was used very much by the opponents of a tax-based, universal healthcare system. And you see it kind of propping its head up again at points throughout history, predominantly when we are with a conservative government, actually. If you look at the periods in time when that kind of narrative is predominant, it's this idea that certain people are undeserving. It's a very kind of subtle but a very effective way of undermining that very fundamental principle that it doesn't matter who you are, how you behave, what has happened to you. We can all become ill and we can all become vulnerable and we all deserve healthcare. So that's one thing. The second thing that I would say is that there is a lot of... I do think behaviours have changed. I do think we can't ignore the fact that people... there is an element of people demanding a certain level of care, and whether or not we believe that's right or wrong, I think is an important discussion. But I think more importantly than that, it's whether or not we can afford as a society to look after people who are behaving like that. And I think this is not unlinked to my previous point. I think that there has been a drive towards consumerization of healthcare. I think we are being taught to be consumers, so we are customers now of our own healthcare system, rather than there being this kind of idea of we all pay into this collective pot and we all take out what we need. There is now this idea that I, as an individual, am entitled to this amount and I should get this. And we see it in the way, kind of healthcare is advertised and framed. We've got things like personal health budgets as an idea being rolled out, very much kind of putting the whole kind of ownership and control about healthcare spending on individuals for the first time, rather than as a kind of a collective system or process. So I think you're right. We are changing the way we behave, but I think that's in part due to a kind of a wider societal shift towards kind of individual consumerism, and that's affecting healthcare and healthcare delivery. But I also think this point is being over-egged for political purposes.
Yeah,
sorry, that's a really long answer.
No, I see exactly what you're trying to say. I think, it completely makes sense what you're saying in terms of the over egging and all the rest. There's been a bit more of a shift in terms of what they would like for, demanding almost certainly in terms of what they want or feel that they are, like you say, entitled to this form of treatment without sort of regard of whether it's best for them or asking for your opinion. They just want it. And I think that it's almost, healthcare aside, I think that's just the way we are nowadays. We want everything quickly. We want everything. We are an impatient bunch of people on the whole.
And also access to information is so much easier now. I mean, Google.
It's completely changed everything, hasn't it?
Yeah, people can come in and they have often now Googled what they think is wrong with you, and it's not, infrequent for patients to tell you.
Absolutely, yes.
What
exactly
they would like.
Yeah.
And it makes it does it. I think we're entering a kind of a new era, which I don't think people being informed about issues, about, their medical or health problems is necessarily a bad thing. I think misinformation is a massive problem.
I think, and I've spoken about this on a different day, in that Google's a fantastic resource, and the problem with Google and Googling a health problem you might have is it's very generic, whereas the doctor that you're seeing is giving you the information or the treatment that they advise based on you at that moment in time, and not what the collective,
and knowledge and skill. Absolutely. And experience. Absolutely. And training, and all the things that that people send us to medical school for to do, except for drinking and pub crawls, obviously, that we never did.
No, absolutely.
But I think we're going to end up being actually more of this kind of, I suppose, a facilitator of making the right decisions in collaboration with patients. I think there's a spectrum of decision making where I think if you're too collaborative, because at the end of the day, a patient is vulnerable. We will all be patient. I have been a patient myself, and I've sat in a consultation room where I've just wanted the doctor to tell me what to do, because I didn't know anything about that topic, even though I'm a doctor. I am not the specialist, and I want to hear from them. So in many ways, I think the skill and the experience in our consultations will drive how much to have that collaborative process with the patient versus,
Absolutely. I mean, there's a reason why it takes so many years to become a consultant in a specialty. There's a reason why you have different specialties as opposed to one doctor covering everything, and that's the reason why your general practitioner refers you on to a specialty, is because they have a broad range of knowledge, but when it comes to one specific thing, that's an entire different, almost degree in its own right, as it were. So you need that skill and that expertise to tell you that.
Absolutely. And what I've found, so in oncology clinics, frequently patients will come in, and I think, totally understandably and rightly, kind of having looked up what their options are. This is a very kind of well-publicised, very emotive disease. Everyone will know someone who's been affected by cancer. They will have spoken to their friends and their family and their loved ones to find out about it. And that's actually, it makes the discussions, I think, very meaningful. Not to say that if people haven't looked it up, it's not. But I found that the people that come in who very much are, they have done all of this research and they want to come in and tell you what they would like to happen, you can really break down what it is they understand about the different things that they've read. And by exploring what it is that they want to happen and what they think is going to happen, actually I find that you develop a much more kind of a valuable conversation about your plan and your treatment from there. And a lot of the most demanding patients, and I say that not in a derogatory way, patients who come in and kind of saying, my cousin in America had this, I want this.
Yes, this experimental treatment and
I've read about this and I demand
yes.
this will work. Actually, when you kind of talk around it, I find that you can tease out that there might be issues about fear, about wanting to be in control of their management. Often people are just very, very scared about what's going to happen. They don't like the fact that they don't know about the disease or about the treatments. And actually just by talking through and explaining what all these things are, I don't think these are bad things. It's just a new age, isn't it? And we have to respond to that.
We do, yeah. And I think this is almost where the privatisation or something comes in that you've essentially got a fantastic resource here, the NHS, and doing its best for the entire country. And then you've got at the moment it's too much it's an overstretched system at the moment. And so the argument for privatisation is, should we be privatising? It will help limit the amount of stress on the National Health Service. If people are going to be paying for their healthcare, will that decrease the amount of the amount of patients that we get?
Sure. Well, this is the current overriding narrative, and again, it is very much a narrative in my opinion. Sure. I think we are very much in a political era of trying to minimise expenditure by the state on healthcare and transfer as much of it onto individuals as possible, and to have as much of healthcare delivered by private companies as possible. I mean, every single metric that you want to look at, the number of outsourced hospital services, infrastructure, land, increasingly staff, the very people making decisions about how a hospital is run. This has all been outsourced to management consultants from the city. These are not civil servants. We've had hollowing out of, policy. It's now no longer healthcare professionals making policy. It's people from the city. So I think this kind of narrative that we can't afford a national healthcare service, or people need to start, pulling up their socks, behaving better, or it will fall on you as individuals. These are political decisions that are being made, and I very, very strongly disagree with them. And I think it will change once the public realise what's at stake and how much there is to lose.
Yeah, I for the sake of interesting conversation, I'd love to sort of spend as much time trying to disagree.
Lots of people do disagree.
But the thing is, I don't really. So it makes it a slightly one-sided discussion. But in truth, the fact is, it could be a system that could be absolutely even better than what it is, if it wasn't for, I would say, money being spent in the wrong areas. And there's cases, we've all seen the cases in America, for example, which is the one sort of other extreme, the privatization of healthcare. And we compare it to the National Health Service, and you've got patients that are essentially not able to afford insulin, or not able to afford inhalers or something like that. And I think this is unacceptable in the 21st century in a third world in a first world country. Sorry, it's not a third world country. This is
but we're not. You know what, Paul? I don't think we're far off, to be honest. And you say, people might not agree with us. There are lots of people, predominantly a lot of the media don't agree with us, because there is, again, this kind of message that the NHS is failing, and it's not. It's a big black hole where money just goes in and is a big waste, and people are misusing it, and we've got all these immigrants coming in and using it inappropriately, and it's just a big bureaucratic Stalinist nightmare. That's very much the mainstream message I would say that I hear. And the problem is there's elements of truth in some of that now.
Sure.
In that I do think the NHS is incredibly bureaucratic, but not because it's a national kind of socialised healthcare system, but because of how marketised it's become. So it's the opposite of what the message.
Yeah, I see. It's almost if it was kept in the hands of the
public,
I think,
yeah.
as it once was.
Yeah, with democratic oversight.
I think even it started already in terms of I've seen. I'm sure you have too when patients come with their clinic letters or with their scan letters, and even already the amount of outsourcing now is. I've seen patients come with MRI scan results or CT scan results, and they say Virgin Healthcare on the top, and various other.
Virgin are one of the worst. They're probably the most talked about offenders as well because they're so kind of well known.
Sure,
but there are kind of hundreds of other corporations, Serco, Circle, G4S, who have got a disgraceful record of providing services. These are companies with histories of fraud, proven fraud, where they've had to, pay fines for causing harm to prisoners, and yet we are now employing them to drive around vulnerable patients in ambulances.
Sure.
And they're making a profit off the back of it. And there's no kind of democratic oversight over the types of jobs they're doing, whether or not they're providing good quality. There was the case of, was it Serco, Capita, failing to send out cervical screening letters. They're not paying GPs on time. Like, there are just countless kind of instances of proven shoddy work, expensive work. This is more expensive. This is what I think people forget as well. These are very expensive services and companies where, by definition, a company has to make a profit for their shareholders. A public service doesn't have to do that. So you are skewing the service that is being provided always towards that profit margin. So there is less to go on making that a good quality service, and you're removing it from the rest of the NHS. It is when I go for an MRI scan, under a in-health caravan, that's separated from the rest of the hospital.
Yeah, sort of a little makeshift portable
unit
outside of A&E usually, or something along those lines.
It's like the visual demonstration of private outsourcing. It is fragmented, it's totally separate, it's unaccountable. They're doing whatever they like in there. They don't know who you are, they don't know why you're there, they're not joined up to the rest of the NHS service, and often they provide poorer care because of that lack of oversight. There are just so many reasons why privatisation it's a failed policy, and yet we're pursuing it, and it just seems to be politically driven.
I think there's obviously we can't escape the fact that things like A&E waiting times are becoming absolutely astronomical at the moment. This is, whenever I walk through A&E department, it is the waiting times are huge.
Yeah.
And going by a system they have in Ireland, I believe, Republic of Ireland, whereby, and correct me if I'm wrong, that people have to pay €100 to be seen in A&E.
Yeah.
And I think the exceptions are if you get blue lighted, brought in by an ambulance, or if your GP has referred you, or there is something seriously wrong, then obviously you don't have to pay. And there is a question of, do we have something like that whereby, if you want to go to A&E, here's your £100, and that will stop the, people with the paper cuts. It will stop the people with the wanting repeat prescriptions, or with a sore throat, or all these things that we could technically, I think they've done a survey once, or a study to show at any given time the people that are in an A&E waiting room, I think 10% of them actually need to be in A&E.
Yeah.
And, is that something we should be considering? Or
Yeah. So again, I think these are really important questions. And I think first and foremost, one has to ask why A&E waiting times have suddenly skyrocketed. And this wasn't always the case. And again, one can correlate it very strongly to a change in government that will have different priorities and will put money in different places. And I don't think it's just a case of, we need more doctors, or we need, more A&E waiting rooms, although clearly that might help.
Sure.
But I think a lot of people end up in A&E because there's no primary care. There's not enough support in the community.
Trying to get an appointment, it can be, I think even it's quite ironic. I did actually post this once at the time of the junior doctor's contract fiasco and all the rest.
Controversial
and,
times.
it was, and I even posted a link to an article that was published in the newspaper about even Jeremy Hunt himself admitted to taking his kid or something along those lines, or was it Michael Gove? I can't remember, one of the two, to A&E because there was no, they couldn't get a GP appointment, and these were the same people that were, advocating that. Yeah.
No, exactly. These politicians, I think they need to be, they need to feel the effects of the system that they are kind of decimating in a way. And primary care has taken enormous hits.
It really has.
Like the numbers of GP practices that are actively closing down on a daily basis, and what we've now got kind of being rolled out are these new primary care networks. So it's basically a new system where you'll get these kind of super hub, GPs, kind of moving away from the older model of your kind of cottage, your local GP.
Looking after your specific area, as it were.
Yeah. And having, thousands of those types of practices, more towards these kind of, again, more centralised corporate hubs in a way, which are being kind of promoted as these centres where it's a one-stop shop where you can have lots of different specialties and types of treatment. What it's doing though is it's causing the gradual closure of hundreds, if not thousands, of practices. I mean, we know that hundreds have closed down in the last few years. We know that we're short of GPs per population, thousand population. And the further people have to travel to get to their GP is a barrier in and of itself to accessing the care that you need. And so people will pitch up. I mean, it's not rocket science to know why people are pitching up at
No, I mean, I've seen people in A&E saying, I just need my repeat inhalers or repeat this, and and you're saying what's the emergency in the nicest possible way, and to say I've been trying to get hold of an appointment for so many weeks, this, that and the other, and there is an element of sympathy and empathy with them because
they've got no choice.
They've got no choice in a way.
And the GPs want to be. I think GPs are getting a hell of a time because they were historically painted as these kind of massive earners on hundreds of thousands of pounds.
It's just not the case.
No,
it's just not the case at all.
It really isn't.
No.
And the poor GPs are working their absolute socks off with increasingly, kind of handcuffed position.
Yeah.
They don't have the time or the resources. I've got friends who are GPs expected to deal with, an 85-year-old lady with 20 problems in 5 minutes. It's ridiculous and it's not possible and you can't do it.
It's true. I don't have much experience in general practitioner world. I remember doing one stint, part of my sort of training program, as it were, when I was a foundation year doctor quite a few years ago. And so I did a 4-month rotation in GP, and I remember by the end of the 4 months, you were trying to get down to your sort of 10-minute, 10-minute consultations, as it were.
Yeah.
And patients would come in with abdominal pain.
Yeah.
This is not a 10-minute conversation. This is by the time taken a history, examined them, and this, that, and the other, and
Yeah.
it's not. And to deal with some patients coming in with very, very complex problems,
Yeah.
and I learned sort of firsthand. It was the first time I'd kind of experienced it, that you just cannot, and you've got 20, 30 patients to see in this whole day, in this very short space to do it. It's an extremely stressful thing, and when people go, oh, this was missed, or this was, it's like, well, it's not that simple. It's not that easy.
Well, and also increasingly, I think, wider societal issues are now being brought to GPs as kind of other markers of support in the community are really starting to break down. So I think because you don't have, the social care in place, because that is being massively decimated and not funded at all and being broken down, or you're not getting the mental health care support in the community. We are in an economic downturn, so people are finding it difficult economically. All of these things are correlated with your health. If you don't have jobs, if you don't have social supports, if you are financially strapped, if you have mental health disorders, and all of these things are linked, if you have an alcohol or a drugs problem, or if you're just feeling depressed, because life is difficult, it ends up at the GP's door increasingly.
Yes.
And these can manifest in a number of different ways. I mean, these are well studied, very well described epidemiologically. These are the social determinants of health, and the GPs end up being the gatekeepers for all of these problems. We don't have the solution for it in a 5-minute consultation, and then it ends up being laid at the door either of the individual GP when things go wrong, or the patient when they pitch up to A&E and they're told that they're behaving in the incorrect manner. It's just, I think it's a self-fulfilling, cycle
it's very
of
easy
decline.
to blame the patient for this.
Yeah.
But
it's so multifactorial, and it's a really complex web of things that you have to intervene in.
And I think, going on from that, forming a privatized healthcare system isn't necessarily going to be the solution for this.
It's the opposite.
It would cause.
Well, look at the state of the public healthcare system in America.
Yes.
I mean, so just to kind of, I think we have to say something about the positives of some aspects of private healthcare. Many would say that you get a choice. Yeah, you can choose where you would like to go. You save time. You're often through the door a lot quicker. And, the best centres in America they provide some of the best healthcare in the world. That's undeniable. But the problem is so clear when you look at something like public health, because the problem with private healthcare and choosing, it is only the people that have the means to choose that can do so. It is predominantly the most disaffected, the poorest, the most vulnerable who cannot choose to do that. And the implications on that for public health is that you have an absolutely deficient public healthcare system. They have a public healthcare crisis in America. So to kind of use that model, which we are increasingly, we're kind of importing policies from the American system, and it's just incredible, because you look across the pond and this country the US has got so many problems at a societal level, compounded by their healthcare system, and we are importing some of those policies here, and it's just it defies logic. And I think a lot of it's happening because it's happening subtly, and people are not aware. The fact that hundreds of GPs are closing and they're being centralised into these hubs, that increasingly local GPs are being controlled by these CCGs. Not increasingly, this was legislated for in 2012. which have increasingly a number of private interests within that, massive conflicts of interest. We know that's the case. Increasingly, healthcare provision is being decided by kind of
postcodes and
exactly, and also kind of imported city management consultants. So they've got totally different vested interests. So it's subtly being rolled out here, but kind of under the radar of the majority of the public. It's no wonder things are getting worse.
I think also with the, as we said, with the outsourcing of tests, of scans, of all these little things, slowly it's almost introducing the concept of it to patients.
Well, there's a very famous line by a Conservative politician where he is on record as having said, we're not going to tell them that we're privatising the healthcare system because there would be a revolution in the streets. And that's absolutely right. I think the NHS remains this kind of really strong British institution, a real sense of pride.
Yeah.
It is a religion almost.
Yeah.
And we're brought up to be very proud of it. And it would not be allowed for it to be dismantled, because this was hard fought for and well deserved by, I think, the people of this country after they'd been through the Second World War and really, really dark times. They kind of came home and they fought for this right.
Yeah.
And so for that to be taken away, I think would lead to a hell of a lot of civil unrest, and therefore it is being done insidiously.
I think sadly it feels when you're working within the NHS, it's something that I'm certainly very proud to work for, and would never want to see it be dismantled. You just feel with how overstretched it is, and you just want that extra support, be it through funding. I mean, I've yet to work in a hospital that has not started off the annual tax year in debt. It's just from day one, they start and they're already 10, 20 million in debt. This is before they've even spent any money on anything. And it would just be, you're thinking, come on, there's got to be a way around this. And that's having huge detriments on our staffing levels. We're having to again outsource staffing posts to locum agencies that the doctors or nurses or the people that are being recruited by these agencies, they actually might not be getting anywhere near as much as they used to. But that's not to say that the agencies themselves aren't getting money as well. Mm-hmm. So that's costing the NHS huge amounts of money, and because they've kind of done a calculation or whatever, and they've worked out that it's cheaper rather than hiring out, someone permanent to fill that post. It might just be better ad hoc, just to get someone as and when they need, which in the long term it isn't, because you get someone that might miss something, doesn't know the hospital, doesn't know the system, and that universally costs more money and all sorts. So it's a shame. It just needs that, if money was spent better. In terms of, we see so many wasteful things, money being spent on
PFI. Interest, shareholder interest for failing companies that have not provided what they said they were going to provide.
Absolutely.
It's a total false economy.
Yeah.
It is, I think it's a form of madness, to be honest with you, because even just that phrase of a hospital being in debt.
Yeah. Shouldn't exist.
It doesn't exist.
Yeah.
That is a political message, because this is a nationally funded institution where the Treasury could decide tomorrow there is enough money today. I mean, in 2008, we had a national economic crisis, and 20 billion was found the next day to support, banking institutions, because that was deemed to be an economic priority. This could be done literally today, and we spend about 7 to 8% of our GDP on healthcare system. We're one of the richest countries in the world. Other European countries less well off than us spend more, if you're looking at a piece of a pie,
Sure.
our pie is bigger than most and we are spending a smaller slice of that pie. It is a form of madness that these messages are coming across that there isn't enough money. It's total rubbish. There is more than enough money. And to be honest, even if there wasn't, healthcare is one of those things that is worth investing in. Even if we were going to buy into that myth, it is a fiscal multiplier. If you invest £1 into the healthcare provision for the nation, you will get an exponential return because you are generating a healthier society, a more productive society. So just the basic economics of underfunding and outsourcing healthcare to inefficient private marketised providers, it doesn't make any sense.
I think also, let's be pretty blunt. You've got, by very nature, a private company. They're not going to be really caring about the patient. They're not. They're
the
main...
individuals might, like the individuals within the private company. I'm sure they absolutely do.
But in terms of the people at the top making the decisions or making the economic decisions, they're not going to look at it from this is best for the patient. They're going to look at it as what's going to make us more money.
Otherwise it wouldn't be a business.
Of course, yeah. And that's something that I like to think the NHS doesn't do. We try and not to waste money, of course, in terms of we do look at certain things. If there's something that does the same job for less and is of the same quality, we'll aim to use that. But on the whole, I don't know a doctor that thinks on the line of an accountant. They think of the line of a healthcare provider.
But doctors are increasingly being removed from being able to make those decisions. So when I'm in the hospital and I now send histology samples, so tissue biopsy samples, which one has to take to make the diagnosis of cancer, they can now go off to a private pathology lab, miles and miles away, where you have computers answering the phone, you're not connected to the people there. I, as a doctor, did not make the decision to do that. That's been made at a trust level or even at a regional level. So I find now increasingly what you're getting is a kind of separation of decision making between the actual people on the ground doing the work, the healthcare providers, and now there's kind of reams of kind of bureaucratic management staff, accountants, commissioners, people that have never actually provided healthcare who are now making the decisions about how it's done.
Yes.
And I think that is part and parcel of, again, this shift to a more kind of marketised, consumer-driven.
Treating it like a business,
Precisely.
Essentially, rather than...
each hospital in the country is now business. Margaret Thatcher introduced that concept of trusts. So now each hospital is has an individual model like a business. So, I mean, it is happening. I just think people they're not aware that it's happening, and it's happening so slowly. Even us as doctors, it's only when it personally, dawns on us that the G4S ambulance is taking our patient and
absolutely.
the private sample that we've sent to the lab, no one's answering the phone.
Yes, or when I'm trying to get a scan result or something, after hours, it goes to a company somewhere, and it's something I think it's sometimes even in another country. Being reported on because they can review the images remotely. And you're thinking, now, is that really the best way of doing this? How much is that costing? That's quite an expensive, it sounds like quite an expensive thing to me. Even our dictations go to various countries to then come back as in the form of letters. This is not the national health service in if you want to put it, in terms of how it's provided and
absolutely. Run. No, I totally agree. And there's a statistic about the administrative costs of healthcare, which I think perfectly illustrates that point, that in the late 80s, I think we spent about 4 or 5% of our administrative costs in terms of delivering and organising healthcare of the total budget, and it's now doubled in the last 20, 25 years, 30 years, and it just goes, it parallels this bureaucratisation, fragmentation, splitting things up into trusts, making hospitals compete against each other.
Yes.
For patients and for services and for companies, and paying companies that then take a chunk out for their shareholders. It just by definition, it's illogical. It's inefficient.
The way it feels, at least to me, with in some of the places I've worked, certain departments seem to be getting worse off than others, and slowly, it just seems that it's been designed to fail.
Yes.
So that you're slowly giving the excuse to, okay, we're clearly not coping with this.
Yes.
The only way forward is to outsource it to this company, and it's like, you want healthcare? Well, we're providing healthcare.
Yeah.
And in actual fact, it's like, yeah, you are.
Yeah.
But it's not what we want.
Well, that's the famous Professor Noam Chomsky quote about the standard technique of privatisation is to underfund things to the point of failure, and then you present there to be no choice but to bring in private companies to save the day.
Yeah, absolutely, and
that's exactly what's happening.
It is. You can see it.
Yeah.
It's kind of it's almost like what was happening with the junior doctors contract back in a couple of years, and it's still an ongoing saga, as you know.
I do.
And it's you want this, we can't give you this, but we can give it to you in this way, and then you're saying, well, that doesn't work, and it doesn't, and then eventually what's happening is it's causing people to want to leave, or it's causing people to take up locum work, or it's giving people a reason to essentially not carry on with medicine. And then once you've done that, you're already an overstretched system becomes even more stretched, and then you're starting to give the alternatives. Okay, we've given doctors this option. They've chosen to abandon in their drones, even though those, there was for many very little option other than to jump ship and go do something else or practice in another country. So the only solution now is we need to start bringing in other companies. I need to start bringing in privatisation in a very subtle way, and then slowly, as we've seen, it's getting more and more.
Well, and what they're. Remember the narrative that Jeremy Hunt famously made up, because I firmly believe that he made this entire fiasco up to drive down our working terms and conditions, that he wanted to deliver a 7-day NHS. Let's remember the promises, in inverted commas, that he was making the public. Where has that gone, by the way? Totally by the wayside. And it was totally politically driven.
Yes.
And it was all about saving money. It was all about saving money, because that is exactly what they have been doing for nurses, for other allied healthcare professionals. It's about driving down the wage bill. And it was part of their policy. It's called efficiency savings. It's the corporate terminology for cuts. And the whole policy to make us, I think the terminology was to make us doctors more flexible workers, aka cheaper.
Yes.
And also more able to then be amenable to working for other types of employers, reading between the lines. And obviously that political narrative has totally disappeared once Jeremy Hunt got his, he drove it through, he drove the contract through. Where's the 7-day NHS now? That has totally
it's exactly
disappeared.
The same as what it was before all of this conversation started. I don't know about I've been qualified for 10 years nearly now, and all I can say is I've worked enough
night shifts
and weekends. I've missed enough weddings, I've missed enough birthday parties, and I've missed enough family events to be able to say
it was a 7-day NHS.
And I know many of my colleagues and friends have done exactly the same.
Yeah.
We don't have a 7-day government, so never mind.
We don't have any form of government.
I think they're on holiday now for 5 weeks, aren't they?
I hope so. Boris Johnson can stay out of the country for as long as possible.
And to say that we don't have a 7-day NHS and to come up with this false, this lie of if you die, if you go to hospital over the weekend, you're more likely to die. That might be the case, but until that's just the tabloid headline, as it were, But actually, when you think about it, the people that go on hospital the weekend are much sicker on the whole than the people that go in, say, on a Tuesday afternoon after work.
Yeah.
The people that go in at 2 a.m. on a Saturday or on a Sunday morning with huge abdominal pain, they are the ones that are...
There were huge flaws with the studies that were done that Jeremy Hunt cited.
Mm-hmm.
That have been hugely critiqued. There were enormous problems with the analyses and bias.
But he stood by it.
Of course he did.
But it was even when you presented the literature in front of him, and you've got a statistician telling you this is to read it the way you have interpreted it is absolutely rubbish and completely ridiculous. He still stands by it.
Yeah.
And,
but that's the job of a politician, no? And this is how it was politically motivated. And I think that's part of the reason why so many of us, myself included, were so angry about this, because it was very, very clearly a goal he had to reach, regardless of the consequences, regardless of the truth,
yes,
no less.
Yeah.
And we were the ones who would have to pick up the pieces, as would patients be. We knew it. We knew it was lies. We knew that we'd have to face disastrous consequences as a result. We knew there wouldn't be enough of us. Guess what? We were right. And the consequences are still being kind of borne out today. Jeremy Hunt's off to his next role to, wreak whatever havoc he can as Foreign Secretary. Meanwhile, we are now picking up the pieces with even less of us in even worse conditions. And it's a devastating kind of fallout of the type of politics, I think, that exist. But to be less negative, I also think it was necessary in a way to re-engage a lot of us, because I think a lot of us have been
going through the motions of the way, just accepting everything that's been coming to us.
And we're not engaged really with how healthcare is delivered, and I think we need to be. And there's a lot of doctors who felt that being politically active was this was a dirty word, and doctors shouldn't be political. The very delivery of healthcare is a political decision. As we know from looking around the world, it can be delivered in a number of different ways. If we want to be able to deliver good quality care, regardless of the type of person we see before us, which is personally what I would like to do, we have to be engaged in the political process about how those decisions are made. We can't just let it happen to us, because that is what's been going on for the last 20, 30 years. And in my view, it's why things are getting so much worse. So in a way, I think that the whole junior doctors strike, which I was very much involved in, and it was very upsetting at a personal level, was necessary, because it was a bit of a wake-up call, I think, to the profession, that we can't just sit idly by whilst these people are making, policy-based evidence making and driving through things without a real knowledge, or intentionally driving things through because they have an ideology underpinning that we know is going to cause harm. We have to stand up and challenge that and say, no, we don't want to be part of a system that is driven by profit. I want to be able to deliver high quality care for patients, regardless of their background. And I want to be involved in the decisions to make sure that that's around for the next generation.
Sure. It's, I think, at least for me, it was the first time, as a consequence of everything that happened a few years ago when the strikes were happening. And obviously that was the first time that NHS workers have striked since,
the 70s.
Since the 70s, like you say. And that was the first
NHS doctors, other workers
to
have
be,
been,
to be more precise, and definitely looking into it at that time, it's like, there's a lot to this. It's more than just what's at face value here.
Mm-hmm.
If you look at the underlying political message that's being sent, or the underlying aim, if you read between the lines of what's happening here, it just, to me, it screamed of a way of making a system fail. It screamed of a way of introducing a way of producing a more privatised health system.
Yep.
I don't think I'm alone in thinking that.
No.
And it seems that the gateway to it. And I've seen some of the bills or invoices, as it were, from places like in America, just a simple hospital journey for a broken leg, for example, something which we see on a trauma list on a daily basis. 1 or 2 patients operated on a day, at least in our hospital, and you're thinking that procedure, seeing the equivalency of what that would cost in a privatized system. We're talking in the tens of thousands for the ambulance journey there, the administration of oxygen, the just having bloods taken, having an X-ray taken, the theatre, the recovery, all of these little things. I've spoken to a doctor who worked in America, and they told me that it got to the point they're actually counting rubber gloves that they used off the wall. The ones the big boxes that we take for granted. If you taking blood, you take some gloves, and they are counting per patient how many rubber gloves they were using and charging them on a glove by glove basis. And you're talking about a box of nitrile rubber gloves which cost £1.50 for 100 or whatever it might be, and they're using that as part of their invoice. This is not healthcare. This is ludicrous.
It's a business.
It is a business. And the idea of going into that, the NHS is something that I think every doctor is very proud of, and every nurse is very proud of, and anyone who works within it is extremely proud of. And to go from being able to administer what you think is the best possible care using all available resources that you have to the best of your ability, to going to the point where you are counting gloves, or you're almost subconsciously making a decision, thinking, you're looking at a patient and thinking, I don't think they're going to be able to afford the treatment that I'm going to give them.
Do they deserve it?
I'm going to give them the substandard treatment because it will be better for them because they can afford that. And I don't want to give them a difficult time later on. So I'm going to give them this because I think, it almost to be nice, but at the same time, you're producing substandard care, because if you had all the resources available, you wouldn't be doing that.
Well, that's the problem with bringing charges to the bedside. And that was the whole point about removing them. Because if you have economic value assigned to the job that you're doing at the point at which you are providing, it leads to increase inequality in healthcare provision. It leads to barriers to providing that care. And what I think doctors would do well to remember is that it massively undermines that doctor-patient relationship, because any doctor who is remunerated according to the services they're providing to the patient, the level of trust goes down.
Of course.
Because the incentive then exists, and again, this is very well documented, particularly in the United States. You are incentivizing over treatment, over investigation, unnecessary tests, procedures, scans, which can cause harm.
It's funny you say that. I've actually had had an experience where someone went to a private clinic, as it were, because they were just feeling a bit run down. And I looked at, they phoned me to ask about some of the things they were being asked to go and do.
Oh no, your face. What was
I
happening?
was like, don't you dare. I was like, I told them, they asked me I said, what are you suffering from? What are you saying? And I was thinking, this is absolutely, you don't need this, and this. It's like, just go to your GP, mate, get a blood test, this, that, and they were absolutely fine. There was but you talk about the things that they were being told to go and do. It was thousands of pounds worth of investigations, and just completely unnecessary.
Well, it's exploitation, because you've got a vulnerable person, and whenever we're sick, we're vulnerable, whatever it is. Even a doctor in their own specialty field is vulnerable when they are sick, and you will do whatever is required to get well. And if it's your relative, you will do whatever it takes.
Yes. And
any private or profit-motivated institution will exploit that for their own advantage. This is not rocket science. This is the modus operandi of businesses, is to make a profit. Therefore, if you have someone that's vulnerable, that is willing to pay whatever it takes to do whatever they think it requires to get out of that situation, they will do it. And people end up being exploited, and it causes harm. Yeah. There's so many examples of it.
And this is before we get even into the insurance side of things, in terms of if you want health insurance under a privatized system, it's extortionate.
Yeah.
You go and it works almost like your car insurance, basically. So
exactly
if you've got something fundamentally wrong, if you know that you've got a chronic illness, that premium is going to go up, and it's going to be driven to the point where you almost can't afford it. In the same way that you might be able to afford a certain car, but you can't afford to insure it.
Yeah,
it's going to go along those lines.
That's exactly what happens, and that's why millions of Americans don't have coverage, and it's often that kind of inverse rule that the people that need it most are the least likely to actually have care. It's the poorest millions, the people that actually have the most need for healthcare inputs, that are not able to access it. And it's almost the worried well who get the best coverage, and it's a kind of a reverse law of care that you see in a private insurance model.
To quote a U2 song, the rich stay healthy, the sick stay poor, in a way.
Oh, U2.
Yeah.
So insightful, but I do not like their music.
Fair enough.
Sorry. Even though I'm Irish.
No problem. So it is a shame the way things are going. I think, like most doctors, we're obviously against the privatisation of it. Be interesting to know what the public want as well. I'm pretty sure,
They've been asked. They repeatedly say that they are in favour of an NHS.
Yeah.
I think polls consistently show that it's one of the most popular institutions.
Yes.
Surveys are in the high 80s to 90% plus about being in favour of the NHS. Even in times like this, when it is being squeezed intentionally. But I think if enough people are aware of what is happening, and there has to be enough pushback on the politicians, there has to be enough pressure for them to feel the heat, that if they don't preserve it, they are going to be the ones that pay the consequences. But I do think they've cottoned on to that, and it's why a lot of these decisions are now being made behind closed doors with corporate policymakers away from the public scrutiny. But we equally then need to wake up to that fact and start to kind of bring that back out in the open and start having these debates publicly about the reality of what's going on.
I did actually, I wanted to ask you because this is definitely happening slowly.
Yes,
slowly,
undoubtedly.
And the thing is, what do we do about it? It's happening in a very
insidious.
Yeah, and it's happening with with people having some suspicion, but it's not overt.
Yeah.
It's not it's almost somewhat deniable.
Absolutely.
There's an element of deniability. No, this isn't happening. Look what we're doing in this area, this area, in this area.
Yeah.
But when you look at it from closely and from afar and being within the hospital system, you can see slowly what is going ahead.
Yeah.
What do we do?
I think the first thing is about awareness, because people know something's wrong, they don't know what, and they don't know why. And a hell of a lot of kind of work and research and activism and campaigning has been done by a lot of different groups to kind of debunk and really see beyond the rhetoric that we are being told in the media, because there has been this kind of reframing of the debate and kind of cover up really of what's going on. So you've got groups like Health Campaigns Together, which I am very much part of, Keep Our NHS Public. You've got excellent kind of think tank groups like CHPI. You've got doctor campaigners like Yusuf El-Gingi, Louise Irvin, Bob Gill, Tony O'Sullivan. There are lots and lots of people. Professor Alison Pollock, who's done a huge amount of work on exposing the harms of PFI and predicted it before it even happened.
What's PFI? Sorry, actually, just for everyone.
So private finance initiatives, which were basically the kind of legacy of New Labour, but actually started in the Conservative government before that, of the NHS basically taking out mortgages to build hospitals.
And shutting them down.
Well, they used them to build hospitals, so they got private companies in to build these bright, shiny, spanking new hospitals, but that are entirely now owned by private companies with crippling repayment rates. So you've got places like Barts in London who are paying, this is years later, £3 million a week in interest. And, some of these companies are collapsing, like Carillion in Liverpool. And, the hospital then stops being built, but they're still being paid. The CEO still walked away, with a very healthy packet. So it was a total rip-off scam. And it's ongoing. So those are PFIs. They've been widely discredited, despite the fact that they are still ongoing. So there's lots and lots of work that's been done by lots and lots of researchers and campaigners. And I think the public need to be aware of what is happening before you can then be engaged. And then I think it's just to do what you can. And it doesn't have to be big things. Before the junior doctors dispute, I was very much an armchair warrior. I'd sit and watch, Question Time and just throw things at it, get really angry, take it out on my family.
Like a keyboard warrior on YouTube comments.
Yeah, of course.
Yes.
Because you feel like there's no kind of outlet. There's no possible way I can have a say. That needs to go. Everyone needs to realise that as a member of society, you have a civic duty, I think, and you have enormous amounts of power to be able to change what is happening around you. Just tweets, letters, talking to people, calling up a radio show, reading a book and talking about it with your friends and your family. There's a great book called 10 Steps to Dismantle the NHS by Yusuf El-Gingi. And it's a brilliant 10-step breakdown of exactly what's been happening to the NHS over many years. There's NHS SOS, NHS for Sale by Jackie Davis, and many books by kind of campaigners like John Lister. Lots and lots of work that's been done that people can use to kind of spread that understanding and a message. OpenDemocracy.net, RNHS, a brilliant resource for people to understand what's going on. Because I think once you have that awareness, you have that confidence to start speaking up. You know more than the politicians. You have more of a stake in it than they do. And if enough people start saying the same thing, that's when you see the effects happen. That's collective action by definition.
Amazing. And I think that's absolutely acknowledges power in a way.
Yes.
So
people are power.
So if, for anyone listening, if you do want to spend some little bit of time just having a look through those resources, would be very, very insightful and get an further idea into what we've been talking about. So Aislinn, thank you so much for joining us today and giving us idea and insight into what we should be looking for, and also for some resources that we can use to try and help educate us. And no, pleasure. I hope it's been useful for anyone listening to gain insight into some of the hidden troubles of the NHS, which I don't think is spoken about very often, or if it is, it's not in very much detail, and obviously more detail can be found in the resources that Aislinn's mentioned, and I'll do my best to include some links in the description of this podcast. If you do have any questions regarding this that you'd like us to answer, please feel free to email me, and like always, if there's any topics that you'd like me to discuss in the future, please do email me and let me know, and I'll do my very best to include them in future episodes. As always, please take care of yourselves, and I will join you again next time. I'm Dr. Bolivios. Goodbye.